this complete tutorial on our hospital management system. Today, I will walk you through the entire patient journey from registration at reception to consultation, laboratory tests, pharmacy, radiology, eye clinic, and billing. We follow two patients through different scenarios. Patient 1, Adeze Okafor, general consultation with lab tests and medication. Patient 2, Chukwuemeka Nwosu, eye clinic referral with glasses prescription. Now, let's look at the receptionist workflow. This is receptionist dashboard. First, let's log in as receptionist. Let me log out this. Let me log out this reception and log in again. This is, mind you, this is receptionist credentials. So upon logging in, this is receptionist dashboard. You can see today's statistics: registered patient, total registered patient, appointment, and the workflow guide. So let's register our first patient and click this registered button, registered patient button. Let's enter the patient's name. So the receptionist will come here and enter the patient's name, Adeze Okafor. He or she will enter the birth of the patient, the date of birth of the patient. So let's see, this is 15. I'll call it yes. 03. Patient is born on March 1985. She's a female. Phone number. So we can fill out a new number. Please, this is a fake people's data. YouTube, please don't bring down my video. These are fake information. So let's say the blood group is 0+. The email of the patient. Let's say this is Adeze Okafor at email.com. Let's say the address of the patients. Let's give the, let's say, emergency contact for that patient. Chidi Street. Yetunde Street. So let's click register. Great. Adeze has been registered, and notice she gets a unique patient ID, like UMH 2026-008, and this ID is used throughout the hospital. So this ID will be issued to the patient. Click OK. So the patient, this is a live queue board. This board is used for managing the queue in the monitor the queue in the hospital. So the receptionist will come here and then create appointment for patient 1. So he will come here, then create appointment. So we call book appointment. So select department. The receptionist will select departments: general medicine. Select the doctor. We have 2 doctors in this hospital, Dr. Chukwu Emmanuel and Dr. Shola Alao. Let's choose Dr. Maybe this one is available, Chukwu Emmanuel, and date of the appointment today. Then the receptionist will now book appointment for the patient. So that's it for the patient 1. Let's register patient 2. So the reception will come here. Let's say there's another patient by the name Chukwuemeka. Chukwuemeka. So Chukwuemeka. So Chukwuemeka Nwosu. and date of birth for that patient, say 08 19 maybe 72, is a male. The phone number, blah blah blah, something like maybe 51234, any number. For now, blood group, say the blood group is A plus. Email, maybe it could be Chukwuemeka, say Chukwuemeka, maybe .musu at email.com. Now, address, maybe the address, give her the contact address. It could be this street and register. So we have this second patient. Then we give her this ID for that second patient. Then the receptionist comes here to book, create appointment for the second patient. Now you can see this one is waiting for the doctor. So while we are booking for this, so let's book appointment for the general medicine. No, now there is one thing now in this hospital. So we have created an appointment, and there is maybe this patient, this second patient, reasons for coming to the hospital is to see an eye specialist, and the patient both patients have appointment with the doctor, but one is coming for to see the general medicine. The other one is this one is also coming for to see the eye specialist. So maybe reason could be blurry vision and or difficult in reading. So we select eye clinic. So eye specialist. So the eye specialist, Dr. Okonkwo. That one is a doctor for those who have eye problem. So and this is the booking time. So click book. So we are booked for Chukwuemeka Nwosu. So Chukwuemeka is also waiting for to be attended there, to be ushered to the doctor's office. So one is for eye to see an eye specialist. The other one is to see the general medicine doctor. So let's so those both patients are now registered and have appointments. So let's switch to the doctor's view. So we log in as doctor. Let's log out this accountant credentials. So let's say this is let's see with the doctor. So we have Dr. Alao, but one is an eye specialist. So we have one is for general medicine. I think this one, the patient selected this particular doctor's handle. So sign. So now, so this is the doctor's dashboard, and you can see today's appointment in the queue. You can see, so we have today's appointment. So this Dr. Chukwu Emmanuel has one appointment. So let's start with our Daisy. So the first of all, when they come in, what the doctor does is, doctor first of all check. I can see now this appointment. So but this long test box, doctor comes here, enter the ID of the patient, because the doctor will request for the ID of the patient first. So when the patient supplies the doctor's his or her ID to the doctor type the ID to confirm. So you can see now. So indeed, Adesina has appointment with Dr. Chukwu Emmanuel. So the doctor can come to this place, or the doctor can also use this particular page, this particular assignment appointment, and then click type the scene, can see to confirm that yes, indeed, Adesina Okafo is scheduled to see the doctor. So we come here. Then the doctor can either come here and continue with the consultation here, or can start the consultation here, or the doctor can also come to this aside page, this aside menu, medical records. So the doctor, now we don't have any medical record for today. I think for all, let us use this switch button. You can see we have for all for the previous ones we have done. I think that this one is for yesterday, and then for today, not yet. So we have nothing in this table. So we add record. So the doctor will type the. So it is either the doctor follow this one, follow this using this particular channel, or this one. So let me continue with this particular one. So the doctor comes here from the dashboard, then search. Okay, indeed, Ade Okafo has a schedule to see with doctor. So the doctor will click start consultation. So once the doctor clicks start consultation, the consultation form appears. First, let's record our vitals. So the doctor records our vitals 120/80 for the BP, the temperature 38. Say the patient discovered at the end of the day that the patient has a temperature 38.5. Don't mind about the unit. The units will appear. This mmg degree Celsius. By the time the doctor fill out the form, these things will automatically, the unit will append to the values. So pulse. Let's say the pulse is 85. The weight is let's say the patient weight is 65 kg, and the weight is 5 kg. The pulse is that. Then patient symptoms. Maybe the patient present with maybe with fever, body weakness, and loss of appetite for 3 days. So report mild headache and joint pain. So represent maybe the symptoms are discovered by the patient according to what the patient was complaining. She say maybe she has fever. She complained of fever, body weakness, and loss of appetite. So the doctor will enter it in this test area, and loss of appetite. 3 days. So diagnosis: suspected malaria with a possible typhoid infection. So the doctor will write the diagnosis. Maybe suspected malaria with a possible typhoid co-infection. So the doctor will also, maybe if there's any treatment plan, doctor, you better know this. I mean, not a doctor. So let's say the note, maybe because patient appears mildly dehydrated, advise and increase maybe fluid intake. So patient appears mildly dehydrated. Okay, dehydrated. And maybe the doctor advised to increase fluid intake. So after the notes, the doctor will save the record. So we can see now these are populated now. So suspected malaria with possible typhoid co-infection. So now the doctor now recommend I recommend Adese or go for lab test. So Adese needs lab test to confirm the diagnosis. So let's order some tests. So doctors come to this. I can see that this tip tip say request lab test. So doctor click this button, lab test, and then once he clicks this lab test, then the doctor select some of the tests that the patient might require to go for. Maybe you look at the You can see the amount of all these services, 3,000 for blood sugar, for blood count, all these things have been listed already. So we come for, let's say, malaria parasites. With that test, malaria parasite costs 2,000 naira. These things can be adjusted from the pharmacies with the test. So then we order for maybe full blood count. So the doctor now, I think it should be, can see the amount here. We selected items, can see now. So everything will cost the patient 10,000 naira. So we click submit. So if there's a note to give, there's a note here. Doctor can append a note here. Then they can write a note here. If there's none, let's click submit. Yes, you can send a days Okafor to library for full blood count malaria with that test patient. We need to pay at cash office first. Click confirm. So lab request submitted and patient should go to cash office. So the lab request has been sent. So notice the request number, lab, that's social number. We saw that. So the patient must pay at the cash office before the lab can process the test. So that is for the so let's look at the lab man. So the lab man comes here. Let's close this. Let's go to the lab man's let's enter the lab man the lab person's credential. So the lab man, once the patient goes to the lab, and let me tell you, before going to lab, the patient must pay, as we have said, according to the workflow, must go to the cash office to make payment before accessing the lab services, going to meet the lab people. But first of all, if the patient now want to be smart enough, maybe the patient want to bypass that going to the cash office to make payment, and then once they present themselves in the lab, and then the lab man enter his or her patient ID, they will search like this. Look at it. So this system will prevent that. So the patient must pay at cash office before lab tests can be processed. So she will be directed to go to the lab to make payment first. So let's go to the cash office to make payment. So let's enter the cash accountant or the cash office credentials. So the cash man or the cash woman or the person in charge of the account section of the hospital will enter the Adeze's ID and then search. So there's a pending request, which is a lab. So she can see the lab or the services or the selected by the doctor, malaria parasite with that test. These are the things to be conducted by the lab, and the amount costs 10,000 naira. So the lab man will keep billing now, create invoice for the patient, and then log that payment. So as you can see, so the payment is recorded. Now, even though you come here to record, you have already recorded, so it prevent double. You can create a duplicate. So now, let's log out Mrs. Adez, the accountant, and let's go to the lab man. So lab man can now carry out the test since Mrs. Adez has made the payment for such services. So let's enter Adez. You can see now Adez has paid for tests for malaria parasite with that test and the full blood count. So the lab man will collect the sample and start processing. So the lab person will start processing. Then the lab person will now enter the result. Let's say the result of the malaria is positive. With that test, maybe it's positive. And the full blood count, let's say it be 75. The doctor can also give out remarks here, enter remark here, then save and now wait. Now let's first, okay, you are sent already. Okay, I wanted to show you something. So if you look at the key, see what is happening here. Okay, because this instruction to return, I wanted to show you when the patient was with the lab people. This thing this status will change to lab, but now it's returned because the lab people have finished their service and they've returned their the report to the result of the lab to the doctor. So Ades is expected to see the doctor. That's why this status change to returned to doctor. So from at that point in time, the receptionist can be able to monitor where the patients are at the hospital and which services are they receiving. Oh, this is a very awesome application. Very awesome. So now upon returning to the doctor, let's log out this lab person. So upon returning to this doctor, so once you come to the doctor asks, okay, where's the ID number? Then the patient supply the ID number and they confirm, of course, yes, lab done. So Adeze can see now the status is lab done. So okay, yes, what happened now? So Adeze need to continue with the consultation as well. So the next step is continue with other aspect of the consultation. So the next step is precision. So doctor click continue. So you can see all these things. So these are where we recorded the body weaknesses, when we enter the vital. Okay, this is suspect malaria with typhoid. I think this is typhoid. Typhoid co-infection. Typhoid co-infection. So okay. So patient appears mildly dehydrated, advised to increase fluid intake. So these are the things we enter. Then what doctor does now, once doctor will confirm whether he or she has gone for lab. Yes, malaria parasite wider test full blood completed. That's wonderful. So the parents come here, the doctor now so the doctor prescribe now click here this prescribe button. And then the doctor now select the so let us prescribe medication. So the doctor prescribe medication for the patient. Let's see, for artemether, lumefantrine, we have 200 in stock. Then maybe 4 tablets. Frequency twice daily. Say duration 3. Then the quantity, we have quantity, let's say 24. So you can add another medication. We can also have a custom. If you want to have a custom medication, you can add a custom medication. But we are selecting the one we have in the hospital from the inventory, from the pharmacy stock. So select. The second medication is paracetamol 500. Let's check for paracetamol. Yes, we have paracetamol. So you have now 99 in stock. So remember, as we are selecting from this inventory, the total number in the stock is also depleting. So 500. Then dosage 2. Frequency, let's say we have 3. We are supposed to take it 3 times. The patient also take it 3 times daily. Our duration should be of maybe 5 days. And then quantity we are going to give out is 30. So we keep on adding medication. So maybe if it is for oral dehydration, you add others. You can, if you have, depending on what the way the doctor wanted to do. So this is the thing. The patient, the doctor prescribe medication for the patient. Now you create prescription. So prescribe medication for days or for artemether, lumefantrine. All these things we have the doctors have entered will be displayed before will be displayed so that the doctor can confirm all the medicines that we are prescribed for these patients. So patient will need to pay at cash office first, then collect from pharmacy. So click confirm. So the prescription is sent to the pharmacy. Again, the patient pay first at cash office. So the patient now head to the pharmacy. And before going to pharmacy, what the patient does, first of all, the patient go to the account. So the account, now if you look at all these things here, we have the lab pending prescription, I think Adeze should be present. So you can, the cash officer can also click, but it's always advisable to first of ask the patient to forward the ID for you. So once they click ID, you click search. Okay, indeed, this is for all the services. 2 items. You click bill now. You have 37,500. So remember, and we total the money. If you look at the total revenue for today, I think we have 10,000 naira that was recorded. So if you add this one to it now, 10,000. This is a total of 37,500. We record the payment. Good. So we have a total of 47,500 naira. And these are the what you have done for this month. You can see the statistics here. This is very awesome. And the cash office can check the invoices here. Look for the invoice. And then if it is for this Adeze, the invoice created for Adeze. These are the sales ledger. This sales ledger is very awesome. Can generate sales report today, previous day. So you just click. So this is for today only. You can export to Excel. If you click export to Excel, let's see what is in there. Excel. Open it. So we can see awesome. 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 So you can see now. So these are the invoice, the patient name, patient ID, service amount, and payment method. Let's close this. Thank you for saving it. So you can also print it here. So, and if you want to give out the receipt for the patient, you come here. See, this is for the 10,000 naira for Adeze. I think there was 2 payments, one for the test and the other one for the amount for the drugs she bought. So if you click this, you print this is the receipts. This is awesome, very awesome. So this is where they create the print. You can see the payment, the Adeze for pharmacy and medication. So 37,500 naira. So for the test, I think I have for the test too. This is where the accountant will print the receipt for the test. This one is for the test. Is it for the test or what? I think, okay, this is pharmacy and medication. So we have something like that. So for this, for the pharmacy, and that one is for the, okay. So we have something like that. Let's check the, okay, yes, this is it. So, so we can see for laboratory tests, malaria parasite. So we print the cash office, we print 2 receipts, one for the test and the one for the medication that he bought from the pharmacy. So Adeze consultation is complete. She now needs to, let's check the, you can see now. So cash to pharmacy. You see now, this status change from cash to pharmacy for Adeze. This is a receptionist side. So we come here. So like I said, Adeze consultation is complete. She now needs to go to where she has gone to do partnership for lab. Okay, she bought, okay, it's okay, it's now in the pharmacy. So until pharmacy dispense, because it's only one state that's left now. So Adeze has made payments. Thank you, Adeze. You have made payment, so we can go to your pharmacy and collect drugs. So let's log out and see the from the pharmacy end. So pharmacy, sign in. So Adeze comes and they present itself before the pharmacist. Pharmacist request for the ID, search ID. Okay, Adeze have made payment to the cash office. Want to purchase Artimenta, Lufematry, Paracetamol 500 mg. So what the pharmacy does just to dispense, and after dispensing the drug, and then click this in and then confirm dispense. So Adeze consultation is now complete. She now needs to return to the. She can now take the what do you call it, the medication to his place. So now, so the consultation is complete. So if you come here, so you can see done. So a days will come without even refreshing the page. So automatically status change to done and blue done. This is very wonderful. So let's see the patient 2. So let's check the patient 2. The patient 2 is with the eye specialist. So let's log out. This is consultation is done. So she has gone to cash office to pay for lab tests. She has gone to laboratory for sample collection. She returned to cash office to pay for medication, and she has gone to pharmacy to collect medicine. So we are done with Adese. So let's look at what's happening at the eye specialist side. This patient that requested to see the eye specialist, Chukwemeka Nwosu. So once it's done, we can see from my results. This one, the reception can call this guy. Okay, call Chukwemeka. Okay, Chukwemeka, you can now go and see the eye specialist. Called. So let's see what is happening at the eye specialist dashboard. Eye specialist. Now, please, before going to the eye specialist, let me show you something. This thing cannot be, this tutorial cannot, we cannot exhaust everything in one video. So let me show you the doctor side here. Should there be a situation whereby there is admission? This is where this is where we click. If the patient requires to be admitted, so that's why we have this aside the menu admission. So this is where we create the admission request. So the doctor will request for the admission. So when you click request admission, they will search let's say this is the patient require admission. So you search for the bed and select a bed. We create this bed here. This is very awesome application. So this is where we create bed. So so let me show you. So the bed is from the admin side, I think. So let me, before we go to that guy going for the eye special, let me just show you some feature I added on to this. So let me check the admin and admin. So the admin will create all these things. You can see now. So we have admission. This is where the admin create add word and some other things. So I've added word. This is a private word, 1,000 naira 500 for a day. So this is where you can add the word, put a code, the word name. Is it for private? Is it which one? Number bed and the amount. So this word will be available for the doctor. So once the doctor just requests for admission, they will just fill all this in. And the admission. So this one also handle for patient that want to maybe take admission, so want to kind of be spend some days in the hospital, maybe 2 or 3 days. This application handles that seamlessly. So that's it. So let's look at that one. Maybe that one will be. Let me look at. Let's log out the system administrator. So let's continue with the what they call it, the eye specialist. So sign in with the eye specialist. So eye specialist. So we have I think okay, well, this is okay with Dr. Chukwemeka. Okay, name Chukwemeka Nwosu. All right. So let's see what is happening at the eye specialist side. So I think the workflow is, let me log out this eye specialist. Let me enter let me see at the end here, see what is happening. Okay, this is Chukwemeka Nwosu. Okay, want to see with Dr. Okonkwo, eye specialist. So okay. Let me see. Okay. So let me check out the eye specialist. Where is the eye specialist? Dr. Okonkwo. So we have before the eye specialist work this way. This is the workflow. One, the patient is referred to the. It can be referred by the general medicine to the eye specialist. Before going to the eye specialist, the patient must pay a consultation fee first before seeing the eye specialist. So you must pay a consultation fee. So I think let me log out and see from the accounting side. So let me see the accounting side. Let me log out. Let me enter the patient ID. I think it's patient ID. Eye specialist was Ade Okafor. No, not Ade Okafor. It should be the other guy. The other person, Chukwuemeka Nwosu. Chukwuemeka Nwosu. Chukwuemeka Nwosu. Click search. Found Chukwuemeka Nwosu. So, okay, Chukwuemeka Nwosu. Think, okay, the workflow is this. So, no anything recorded. I think the workflow is this. The eye specialist must go to the general medicine first, doctor. The general medicine now refer the eye specialist. I think that's the workflow. So let's enter. Let's cancel this. You can cancel the appointment here. So with general hospital, let's cancel this one. Confirm. Appointment cancelled. So let's re-enter the guy and then use general medicine. Let's enter here and follow through the general medicine doctor. So the general medicine was, so the patient will come to see the general medicine doctor. General medicine doctor will refer the patient to the eye specialist, and the patient must pay before seeing the eye specialist. So, Chukwuemeka, let's enter the second person. Let's call it Chukwuemeka Nwosu. Chukwuemeka Nwosu. So let's give it any date of death. Let's say this one is 04. Okay. Maybe 1972. Any number, any date of birth. It's just for demo purposes. 090 blah 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 blah. Okay, we have number here. Wow. Blood group, say A plus. Email address, kilo. Okay, let's register the patient. So this is the patient ID. So we are using this one. So we are using this particular one. All right. So we book for this guy. Sorry, this one. I think we are using this one. This one. So let's book. Rebook Chukwuemeka. Select general medicine. So select doctor. Maybe we refer the person to see another doctor, Dr. Alao, to this appointment in a book. So we have booked that. So we call Chukwuemeka Nwosu. Confirm call. So Dr. Alao will come here, log out, and then come here. This is Dr. Alao's credentials. So Alao will continue. So Alao first of all come here and type the ID to confirm, yes, indeed, this patient has consultation with him. So of course, indeed. So he continue with the medication. But before continuing medication, see what is happening here. So once he continue with the medication, you click. Now she comes here and the patient asks the doctor that you want to see the eye specialist. So Mr. Alao will refer the patient to the eye specialist by clicking this button, refer to eye specialist. So refer to eye clinic. So maybe the patient is complaining of eye problem. So the doctor now refer him to the eye specialist. So you click eye. You click this button. The general medicine doctor give reasons for this thing. Could be some clinical indication, maybe suspected presbyopia or needs refraction and comprehensive eye exam. So maybe doctor can say, okay, reasons it could be vision check. Okay, vision check. The note maybe suspected suspected presbyopia, and needs fraction and complete comprehensive eye exam. So the doctor now clicks submit and goes to eye clinic for vision check. So he has referred the guy for the eye check. If you come to this, I think the medical record for okay, no medical record, yes, just so you can see the this patient is out for eye. So you can see now out for eye in the receptionist side, out. So in the Mr. Alawo, you can see the patient has been referred is now referred to the eye clinic. So he must pay the consultation fee at cash office first. So let's log out this guy, the doctor. Let's go to the cash office, account office. So before going to see an eye specialist, the patient must pay a consultation fee. So let's log in this ID, search. So this is eye clinic, 5,000 naira for consultation fee. Bill now. So create invoice, record payment. So that this guy now can now proceed to see the eye specialist. So the patient now can now go. Let's log out the accounting credential, the accountant credential, and then log in with the eye specialist. So let's log in with the eye specialist. So you can see now. So we have a pending request in this is the eye specialist dashboard, and we have a pending request at Chukwemeka Musu, and reason for vision check. So he has already paid for the services, for the consultation services. So the eye doctor now come here, they start the examination. So they will enter all these parameters, all these details, we enter all this information for the patient. If the one that requires surgery, they click patient require surgery, and they will select the surgery type. You can see now, and they give out surgery note, additional note. But if not, maybe the patient requires some other things. So if after filling out these things, doctor fill out this thing. If the patient require glasses, they also select the glasses, the contact lens, fill out all this information, and then give out remark and create a prescription. And when they create a prescription, the patient need to go to the cash office to make payment before going to the pharmacy to get those prescribed drugs. This is how this thing works, and it's a very, very, very smart application that solve almost all every hospital needs and hospital requirements or clinical requirements. So this is a very awesome application. So the Chukwemeka, I said, it was referred to the eye clinic. The guy, after the consultation, the eye specialist sent the patient to the cash office to make payment before they get their prescription. So the same thing with the radiologist. That one is also very awesome. The radiologist, you can see this eye, look at Chukwemeka. This is where the doctor can print the whole information about the Chukwemeka. You can see now. So this is where they can print the examination if there's a, so they fill all these things. And this name of hospital here and all this information can be adjusted by the admin. So if the admin comes here, let's say admin comes here, admin can adjust all this information here. Like I've told you here, admin can create backup, can restore backup, home settings. So this is where the admin can change this information. So if I call it, let's say, if I call it, that's how it's going to appear in every page. So if I change anything here, add also, and then give out the name of the hospital, the phone number. This is the currency symbol. If you adjust anything here, it will reflect in all the pages. So you can reflect on all the pages. So let's see if I call this one. Okay, yes, don't worry. So let's save settings. You can see add also. Everywhere we appear. This is where we change information already also. So in the researching side also, it's the name of the hospital has changed also. So we have something like this. Very, very awesome. And this is a ward guide. This is where we can how to support the ward, admin patient, and manage beds. So all these things are setup guide for the admin that will handle this thing. So we click the setup guide. How do you handle the ward admin? You log in as admin, go to admin, so just the guideline, ward admission guide. So these are what the admin read before going through to operate on how to add word and fill in the word details and some other things. These are the word guide, doctor workflow. So you can see now request admission, the doctor login as doctor, go to admission from the sidebar, click request admission, fill in the patient, the ward, number of days. These are for those people, the patient that will be admitted into the hospital. So click create request. So this is just read out those workflow. Very, very, very awesome. So doctor discharging the patient, the doctor will have to go to the dashboard, find the patient call admitted list, click discharge button, review charge and balance, enter discharge summary. Very, very awesome. Very, very awesome interface. So we have, so this is how we set up the LAN. If we want to set up the LAN, this is where we click and then we configure how to make this thing work locally without using of internet. So let us look at the cash office. So let's log in, log out. The radiology also have their own, but just like I've said, everything cannot be contained in one video. The radiologists also have their own dashboard. This is where we have their dashboard. If let's say the patient is referred to a radiologist, let me use this in. Let me log out, doctor, radiographer. Let me log in as a doctor. Let's say this doctor. Okay, we have a patient with Dr. Alawu. So although he has gone, but maybe the patient later return and say, okay, I want to go for what they call it. I want to go for X-ray or something like that, So this doctor will click X-ray, and then we select the services for that services. Let's say 15,000 for abdominal ultrasound. Maybe the patient want to go for abdominal X-ray. Anyone. So if it is maybe abdominal ultrasound, you click submit, and then you confirm. So okay, it's a clinical indication feed is required. So you give out the clinical indication feed. You write something, blah blah blah. I'm not a doctor, so you must write something, a clinical indication and note, and then click submit. Then confirm. So radiology request submitted. Patient should go to the cash office. So the patient must go to cash office before going to because they must pay some money for consultation before going for that radiology. So when it comes here, let me log out. So let's see what is happening at the cash office. So let's enter the patient ID that is going to maybe for X-ray. So 15,000 naira abdominal ultrasound. That's what it costs. So we must pay that money first. You create invoice, record the payment. So now that patient, this guy now can go and see the patient now can now see the radiology. So the radiology will come in with their credential here, login. So they will see, they will come here. You can see pending request. They will be the first or search the patient by ID to confirm. Search the patient, you can see the patient. So it has paid already, so they can start the examination. So the radiologist can start the examination here, enter the results. So if there is a scan, they can come here and upload. They can enter, if there is a finding, they enter their finding. If there is this in the scan, so they enter their finding here, blah 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 blah. There may be impression and conclusion. They write it here. So this is where they make their findings. Enter, they complete and send to doctor. So they can complete the radiology examination for Chukwemeka. Once the result will be sent to the referral doctor. That's how it will be sent. So we send to the doctor. So doctor will see it there. So when the doctor, let's say the scan and everything, the radiologists make their own request and send to the doctor. So once they send, the doctor will see all those things. Let me confirm first. So the radiologist say the patient can return to doctor, view results. So the doctor can, this is where the doctor sees the whole medical journey for the patient, the medical history, So all these things are, the doctor come to the medical records. This is where they can view the medical records of this guy, Dr. Chukwemeka Ades Okafo. So they check the prescription. Okay, these are the drugs we were prescribed for the doctor, for the patient. The lab test, yes, he has gone for part of the positive 75. Radiology, no radiology. Okay. So I think, is it okay? I was entering the another ID for somebody. I think is it for car for USF? Okay, it should be I think Dr. Lawo. I think that patient, every doctor has their own rule. So I think it should be with Dr. Alao. I think did we refer the guy to Dr. Alao? So that handle the, but this is how it works. There is no any this thing. So that's how it works. So we have gone through all this system, and the system is working perfectly. So that's how it is. So we have things like that, and then I think this is where the okay, this is the pending. Okay, still pending. Okay, this one is another person entirely. I think this one is the one that made that payment. No pending. Okay, sent to doctor. So so like I've said, the doctor side, if you come to the doctor side here, so when the doctors enters the patient ID, this is where they can also access this is where they can access their medical records for today. Okay, this is Ades Okafo. Okay, so this is where the doctor can view every detail about that patient. This is where the, and the reason why this one is not showing, I think, is because I did not upload, I didn't fill out some information. So I didn't like fill out some necessary. Okay, we have sent the patient to, we have sent the patient to the cash office. So he or she must pay at the cash office first. I think so. Let's check at the cash office. Cash office, I think has paid payment. Then and then must go to and think. There's no point. There's no point returning to the doctor. So the eye specialists have their own department entirely. So they do the same thing with the doctor. So they refer you to the specialist. You come back again. So that's it. I think that guy has made this payment. Yeah, you have entered this thing before. So the workflow for the cash office is this. The cash office will refer the patient to the eye specialist will refer the patient to the cash office to make payment. Then they order. After payment, they prescribe drug. They go the same flow again. They go to the pharmacy and they pay again to get those drugs. So there's no need referring the patient to the doctor. So eye specialists handle that. I think that is how the workflow here. So let's log out and see what is happening at the account section. So let's go to the account. So let's go to the account. So you can see the pending prescription. So we have that. Let's go to the account section. So at the account section, so no, not that one. Not sorry, not this one. So at the account section, the accountant, this accountant dashboard. So like we handle this is where we handle all the billing and payments, process payment for patients, and then so this is where we see all those things. So this is where you can see this is where the invoices appears. So and here we can see all from here now in the accounting section. Here we can see all the pending requests, So if it's that radiology, this is where we have this one. If this is the one pending for paying for the decent lab, those that are gone for lab test, they need to pay. This one they pay. This one is the one for pending admission deposits. So this patient booked for 3 days to stay in the hospital. This is where the cashier will receive the payment and then send. Then I've told you this is where we create an invoice, record the payment. Then the payment history. So this is where we see all these things here. You can see the payment. You can print the receipt here. If you want to print the receipt, This is where we print the receipt for the patient. So we have seen the lab session. We also look at the what they call it, the eye specialist side. We also have checked the pharmacy. I think let's look at what is happening at the pharmacy. So let's check at the pharmacy. So this is the pharmacy dashboard. So we see prescription that have been paid. So look at all these things. So this is where we see the awaiting payment, the ready to dispense today. So this is where we have. So if we have, let's say, somebody that need to be prescribed drug, no prescription found for this patient, good. So we have something like that. So this is where we get the inventory. All right. So for that eye clinic, so the eye specialist, like I've told you, the eye specialist login with his or her password. So the eye specialist login with his or her password, like we have told you. So if this is the eye specialist, they will log in with their passport. The reason why this thing was just because I could not fill some things. So they have to start the examination. We have not started real examination. So they start the eye. This is eye specialist dashboard. So we can see patient that are we can see patient referred to for eye examination, and Chukwemeka must have paid and is paid, has paid. So Chukwemeka has paid and is ready for examination. So we must click this thing. The reason why it's why because we did not fill out all these things. So we have to fill out every information here and then complete that examination before we can see, before we can refer the patient to the what they call it, to the cash office. So we have filled all this information. Let me just take time and see what is happening. Let's try to fill those information first. So let's say for the right eye, we have 618. Left eye, let's say we have 612. 6 over 12. Let's say both eye, we have 612. 12. The right eye, 16. Left eye, 15. I'm not an specialist, so but it's just a sample of what this application is capable of doing. Right? So let's say we have for the refraction, we have plus 1.50. Let's say for the left eye, we have 15 plus 1.25 plus 1.25. So the anterior segment, let's see, clear corona, normal anterior, chamber depth, DEPT. Okay, so we have give all those things. So for posterior segment, we say normal, maybe we call it normal fundus. So doctor diagnosis of myopia with mild, maybe the doctor diagnosis result, say let's say presbyopia with mild hyperopia. Eye specialist, you better know this. So the treatment plan, maybe prescribe reading glasses. Reading glasses. So this is where they enter all this information. So they click save. They have to click complete examination. You can see now. So complete this examination. So the examination is complete. So we come here. If the one that requires we can also view these details. You can do some editing if you want to edit the details. So if you want to edit, we come here. Sorry. Click close the glass. If you want to edit, you come here. You can see this trick maker. We can edit the record here. Doctor can edit and then re-enter all these things here. Then save changes. You can also print it. So let's go back and see the examination again once more. Completed examination. So this is where we can recommend glasses. So if you want to prescribe glasses, click glasses. Right? This is what you are going to do. This is what we are supposed to do. Then before creating prescription, the patient go and pay. So for the right eye, we can say okay, plus 1.50. The cylinder will be minus the axis dash, add the add should be maybe plus 1.50. The left eye plus 1.25 plus 1.25 plus 1.25 plus 1.25. So maybe this one is dash, axis dash, this is plus 1.50 plus 1.50. So the pupillary distance maybe 64 mm. Price, so give her the price, maybe 15,000 naira it will cost. So remarks, so the eye specialist enter the remarks here. Progressive lenses, so they enter their report here. Progressive lenses recommended. This is where they give their remarks for reading and distance, something like that. So they now create prescription. If they want eye drop, this is where they click for the eye drop. So eye prescription created, so patient can now go to the cash office to pay. So this guy will now come here and go to the cash office. Account, go to cash office. You can see now. So we enter the patient ID here. You can see now glasses has appeared. You can see now. So we have the eye specialist and its recommended glasses. So you have to pay for this 15,000 naira to get those eye glasses. So you can see now glass prescription 15,000 naira. So they create invoice. The cashier will now record the payment. This is awesome. So like I've told, we have seen the glasses. The glasses were prescription was created by doctor. So Chukwemeka needs to pay at cash office, and so which he has done now. Then he can take this prescription to any optical shop. So the doctor also can also prescribe eye drop. We saw the eye drop. So the same similar process. He prescribes some lubricating eye drops. They enter they fill the medication form. That's that place we saw eye drop. So they fill the medication form. This prescribe they create a prescription. The patient now goes to the pharmacy after payment. So they can also print eye examination reports. They print this prints a professional eye examination report that the patient can keep. So we have seen a lot of things. If you look at the accounting section side, we have given you the invoices, what the invoices are capable of doing, the sales ledger that will give us the general sales report. You can do for that of, let's check that of previous day. Let's see what we have in that of previous day, which is you can see now. This is for 1301. These are the payment method for 3,000 sales for total revenue for that day. You can also go for today, which is 14. Generate reports. So give us a report. This is 2,500 sales. And all these things are the transaction details. You can print all these things. And the report can be exported to Excel for accounting purposes. So we have seen a lot, the admin dashboard. So the admin has access to everything: staff management, hospital setting, all report and system configuration. This is a very, very, very awesome interface. Very, very, very awesome interface. So this application is built on Laravel, and like I told you, Laravel is the most popular PHP framework out there and the most secured. I'm using also PostgreSQL as the database. Thank you for watching. So if you have questions, leave them in the comment below. Don't forget to like and subscribe and hit the notification bell.